This video today is about simplest possible management of punctal stenosis, the one snip procedure. Now puncta are the structure which are the opening of the canaliculus which are seen at the medial end of both upper and lower lids, and these provide the access to the excess of tears into the lacrimal drainage system. The puncta, whenever they are stenosed, can cause symptoms of watering without discharge. The common causes of punctal stenosis are chronic blepharitis, unknown etiology, ectropion of the lid, and drug related, especially those drugs which are used for a very long time, the anti-glaucoma drugs. The diagnosis for punctal stenosis is made clinically based on symptoms and signs, and one of them is dye disappearance test. If it takes fluorescein dye to disappear taking time more than 5 minutes, then this is positive for punctal stenosis. And symptomatic relief after punctal dilation. Now here it is very important to understand that numerous patients who have apparent punctal stenosis on inspection may not be symptomatic, so they don't need any intervention. Now here we have a patient who had significant watering for quite some time, which was relieved on punctal dilatation. So this patient was planned for one snip procedure for treatment of their punctal stenosis. So here first thing to be done is dilating the puncta using a nettle ship punctum dilator, and this procedure can either be done under topical anesthesia or it can be done under local anesthesia by infiltrating lignocaine along the inferior border of the lower lid. Once the puncta has been identified and dilated, one can use viscot scissor to cut open the posterior wall of the vertical part of the canaliculus, that is the ampulla, and this will provide a larger puncta, and more so it will simply cut the sphincter muscle present at the punctal opening, and so that there is later on minimal possible shrinkage of this puncta, which usually occurs if only punctal dilation is done. And this procedure can be done bilaterally at one single sitting, and here we'll see that punctal dilation is so very important before proceeding, because in this case it is not even possible to identify the puncta. So after some amount of probing, it was possible to identify where the puncta lies, and this is frequently a problem in these individuals who have punctal stenosis. Once the correct opening has been identified and dilated, similarly again a Viscot's conjunctival scissor is inserted and the posterior surface or the posterior part of the vertical part of the canaliculus is incised. Thank you.